This e-learning module about nuclear medicine is based on an article that Peter Hogg and I wrote for the Nursing Standard in 2015. That article and this RCN e-learning module both aim to give nurses an introduction to what's involved in nuclear medicine imaging procedures. We wrote them to draw the attention of nurses to a larger e-learning resource that we have jointly edited for the College of Radiographers. This was commissioned by Health Education England, and it's freely available to all NHS staff through the e-learning for healthcare website. Information about how to access that nuclear medicine module within e-learning for healthcare is contained within this RCN module. So if you find this introduction useful, you may also want to study the e-learning for healthcare module for more information. Now, most patients won't have heard of nuclear medicine before they're referred there for the first time, and so they're naturally worried about what will happen. Patients may therefore express their worries to their nurse, but often nurses are not well informed about nuclear medicine procedures either. Therefore, these e-learning resources are a great opportunity to educate nurses about what really happens in a nuclear medicine department, so they'll be better able to answer questions from their patients and better prepare them for what to expect. Of course, patients are all different, and so they may have lots of different questions, such as, is this a test for cancer? Isn't nuclear radiation dangerous? Will they have to inject into my bones? Or does the machine make a lot of noise? So if nurses can discuss concerns like these with their patients, then hopefully they'll be less anxious when they come to the nuclear medicine department. However, there are some relevant questions that patients don't think to ask, such as, what will happen if I can't lie flat on my back? What if I can't raise my arm above my head? What if I'm breastfeeding my baby? So if nurses are properly informed about what's involved with nuclear medicine tests, then, if they're aware that any of these factors might cause a problem for their patient, they can discuss this with the nuclear medicine department in advance. So hopefully studying these e-learning resources should benefit patients by improving the quality of information that they can get from nurses. It'll also enable nurses to better prepare their patients for their tests, for example by giving any pain medication that may be needed to help them keep still, and observing any necessary diet or medication restrictions that might interfere with the test. But it should also benefit nurses themselves by giving them better information about how to deal with patients who have had nuclear medicine procedures. There are a few simple precautions that nurses can take to minimize any hazard from the radioactivity that is present in nuclear medicine patients, and these are also explained in this resource. So we hope that you'll find something useful for you and your patients in this RCN e-learning module. It's only a brief introduction to nuclear medicine, and it only covers 3 of the most common imaging procedures. If you want to know more, then we would encourage you to sign up for NHS England's free e-learning for healthcare resource, where you'll find the nuclear medicine module within the College of Radiographers Interpretation of Medical Images project.